Yeah, Miss Chakravarti was very special. Not only was she with us for an extended amount of time, we're used to having clients stay with us for just a couple of days, but she was with us for several weeks.
With the baby arriving early, and we don't have family here, and then it was like close to winter break, so even the friends weren't around. So it was pretty much just my husband and me, and it was tough, you know, going on. And the staff at Durham Regional, especially like the nurses and the nursing assistants, they were wonderful. I mean, we spent such a long time there, and we became really good friends with some of them. And I know they were doing the duty, but, you know, a smiling face whenever they come in, you know, a cheerful hello. And some of them even stopped by, like they were not assigned to me, but they just stopped by, like, you know, going out of their shift or coming in just to say hi. And that made so much of a difference.
Patient-centered care is always putting the patient first. Before you do anything with that patient, you're going to ask yourself, if I was that patient, how would I like to have it done?
From the time the patient comes to us till the time the patient leaves, we consider exactly what the patient wants for their experience. We actually want them to be kind of a part of our family the whole while that they're here.
So we do everything that we can for the patients and the visitors. Sometimes it's as simple as a smile. Sometimes it's helping them find their way, because they may be terrified. They may be very anxious about being at the hospital because most people aren't here every day like we are.
Hourly rounding is important because we know that the evidence shows us it's best practice that the patient's needs are anticipated. We know what the patient is going to need even before the patient realizes they need it. We focus in on the patient, we touch base with that patient, we make sure their pain is being managed, we make sure that our patients are getting assistance to go to the bathroom so they're not falling on their way to the bathroom. We make sure that everything is within reach of the patient. We partner with the patient and the family to make sure that the patient's needs and what the patient perceives as their needs are being met and not just our needs.
And it's not just the patient who's my patient. The baby is also my patient because I work on the mother-baby floor. The father of the baby is also someone that I talk to as well. Sometimes it's the grandmother, sometimes it's the siblings, and I talk to the whole room, and I treat them all with respect, and if they need something, then I try and help them get it.
They did an incredibly special thing. They threw me a baby shower. Yeah, we had a baby shower in the hospital. That just took me by surprise, and I was so incredibly thoughtful of the nurses.
We were a part of her family, and we were there for when her family grew. That's a very special time in someone's life, and I'm glad that we could be a part, that I could be a part of that one.
So you have to put yourself in their position when they're in our home. We want to make sure that they have what they need and that we do them one better, that we have a culture of always, that we always take care of our patients like family.
We're just so happy, and we've been planning to go back and pay a thank you visit to the nurses and show them Neil, because we want them to meet Neil. Yeah, it was scary then, but we just look back on it fondly now that we have him, and we're just so grateful for him and grateful to the nurses and to the hospital for taking such good care of us. So, yeah. Kiss her, thank you. Kiss her, thank you.